The Eastern Cape government is working around the clock to vaccinate more people. It has taken a step to vaccinate people during the weekends, particularly at malls. To date, the province has administered 1.5 million doses. SABC News reporter Abongile Jantjies has more from East London.
East London at Hemingway's Mall, one of the biggest malls here in the region where people are being vaccinated. The health department has taken its measures to vaccinate people over the weekend in order to reach its set targets. With me, I do have the MEC for Health here in the Eastern Cape, Mama Nomakosazana Math. A very good morning to you, MEC. I trust you're well. Tell us about this pop-up site today.
Good morning to you and the viewers at home. We are very excited to see the turnout. Actually, we are more busy today than yesterday. It was the first of its kind in the province, a drive-through, and in particular a weekend site of this nature in Buffalo City, where the population is high. We've been doing a great job in Nelson Mandela, but we are happy because it's a success. It means we're able to create demand, and people are very excited themselves. They're saying the service that they're getting here, the convenience, because we don't have to wait on queues. We are in your car, very comfortable. So we're excited, in particular, to see men having come up in numbers. Men of all races are here. They're very excited, men of all ages, and also other gender, like females and young people of female gender. So we are happy because our aim of creating this particular opportunity was to try to encourage men to come up. When we look at our numbers, even though it's not as bad as it was initially, because we are at 36% at one point. Now we have surpassed 37% of the males that are coming to get the jab. So we are excited, and seemingly we have hit two birds with one stone, because we are here, we are doing the drive-through. At the same time, the people who are in the mall and they're hearing that there is vaccination happening downstairs, they come down. As you can see, there are those who are walk-ins. So I think it's a very brilliant idea, and already we are more than 1.5 million of vaccinations done, and we are also at 1.2 of the individuals that have been vaccinated, with almost more than 700,000 having got their complete vaccination. So it's quite exciting, and we are saying thank you to our people for responding to our call.
So where next with this one, with an initiative like this? Where's the next stop to vaccinate people, particularly at malls, and hopefully take it to township areas, your areas such as Mdantsane, where it has a large population and where people can come and really be administered for the jab?
Actually, we've been doing it in malls, in particular with the SASTA pay points, and now we are saying we'll be going to rural areas, because there's many people that get to one point there to get their pay, and also in the entire province we want to see this type of arrangement happening. And as we were starting yesterday, we were just testing the waters, and we are confident now, and we want to continue with this every weekend up to December at least, because if yesterday and we were starting, we were able to do more than 550, it says then there is a good response, which is something that we are looking for. So we'll continue to do that until at least we reach the target, because remember, by the end of this month we're expected to be at 42,000. We're at 37,000 last week. So we want to push, because we are not comfortable with the numbers, even though we've been complimented and commended for the work that we are doing at the national level, that we are leading as a province, but we are still wanting to do more, because we are also worried about the numbers. Having been the last province to be hit by the third wave, now we are starting to feel the third wave, and the numbers of infections are rising, now are ranging at 1,700 a day. So we want to be fast to get to every citizen to get the vaccination.
How are you mitigating the third wave? The last time you announced it, you said it's quite a concern and people are not adhering to the protocols. Now there are talks of a fourth wave, but we're still in a third wave. How are you mitigating it? How is the department battling with the third wave so far?
The first approach is to move with speed on the vaccination program. The second one is to bring our partners, social partners in particular, on board, in particular the traditional leaders and the religious leaders that we've been working with. We are now intending to go to the traditional councils so that the men, in particular in rural areas, you find them there. So working with our chiefs and kings, we are going to be looking at that. But the third thing is to ensure that, one, we are ready in terms of our hospitals, in terms of bed availability, oxygen, PPEs, which is something that we are doing, because in the eventuality you need to hospitalize our people, we must be found ready. Actually, with the outbreak in schools, we started now to be creative again, to use our own facilities, health facilities, to just quarantine and isolate those that we have tested, quarantine those that have tested positive, isolate in our facilities, even if they are asymptomatic. But we are also happy and comfortable to see that our young people, even though they got infected in numbers in the last days, they are recovering in numbers also. So we want to say to our people, the NPIs are still the best thing for all of us to do. We are worried about the relaxed environment, people not wearing masks, as if now the COVID-19 is over, and we are still appealing to our people to please keep on putting on their mask when they are going to public. They must keep on washing their hands with water and soap, or sanitize with alcohol-based sanitizer, and continue to observe the social distance.
Coming to schools, a number of schools, I remember 2 weeks back it was about 89 schools had confirmed cases of COVID-19. This last week you held a joint briefing with the education department of the province. The last time we spoke to them, they said they were waiting upon the health department to advise them on the way forward. So how did you advise the Eastern Cape Health Education Department with regards to with the surging numbers at schools?
The best thing that we did working with the Department of Education, one is to ensure that those who test positive, they get isolated. And even if they don't stay in boarding schools, those who were day scholars, we brought them to boarding schools, except for those who did not want to isolate, preferred to go home. So that's the first thing that we did. And we also tried to reinforce the work that we're doing in terms of contact tracing and tracking, and also testing, making sure that almost all those contacts are tested. And we did that. I think we were successful, because when you look at the numbers, even though we can't we can't shout and say we are out of the wood, but we are seeing the numbers are being managed. Because if you look at the previous days, it's 1,600, 1,700, because we had seen a spike which was more than almost 100% because of the school's outbreak. So we are thinking, no, our approach is right. We are able to manage this issue of the outbreaks at schools, working with the Department of Education.
Okay. Lastly, the department, the filling of key positions within the department. Are you winning that battle so far?
We may say we are doing our best, understanding the financial constraints we are at, as you all know, that we are a department that has a 4.4 billion budget deficit as we started the year 2021, 2022. But it is our project. Actually, I'm sitting every weekend, every Sunday with my executive management, wanting to push the issue of recruitment within the constrained environment financially we are finding ourselves in. But it's better now. We have targeted, in particular, the facilities leadership, your CEOs, which is something that will be finalizing soon. And already we have started to recruit the nurses and all the clinicians. And we are also looking at the issue of contract workers. As you know, that we extended their contracts up to end of November. We'll continue to look at that matter to ensure that, one, we've got contract workers for COVID-19, both the resurgence and the vaccination rollout, and also looking at our facilities, because it is only when we deal with the issues of public health that we'll be able to defeat the COVID-19.
Have you noticed a sense of fatigue amongst the health workers, particularly the ones on the ground?
Yeah, these workers are so amazing. You see, even the people here on this site now are asking me, what have you given your employees so early in the morning that they are so amazing? They are just friendly, kind. You know, naturally they are fatigued, but fortunately they are trying their best. They're not showing that to our clients, and we appreciate them for that great work that they are doing.
And thank you so much, MEC, and all the best with this program.
Thank you so much.
But that was the health MEC in the Eastern Cape, Nomakosazana Meth, saying that this program, this initiative of vaccinating people at malls and at malls whilst they're doing their shopping will yield some benefits. If we could talk to some of the people who have come to vaccinate, we'll try our luck here. Hello, we're live on Channel 404. We are here to vaccinate. How are you feeling?
How am I feeling? I'm not sure how I'm feeling. I'm very emotional way too, but I want to do this. For your safety, even regardless of what other people are saying. But yeah, if they say I'll be safe doing it, then I'd rather be safe than sorry.
How do you feel about the convenience? You were here to do your shopping, but now you get a chance to be vaccinated. How does it make you feel?
I love it because seriously, I've been like stalling PPE. So now that it just came to me, like I'm doing everything at once, I think it's very convenient. I love it.
I thank you and all the best.
All right, thank you.
Well, that was one of the people who have came here, one of the shoppers who have came here for vaccination. Well, the cars are still making their way here. Some of them are really coming here. We're seeing a large volume of vehicles. Some have even come as early as 7 o'clock.